Good morning, everyone. On this Tuesday, I'm Jessica Lovell in for our Chief Medical Officer, Dr. Steve Stites, who is taking some well-deserved time off. Welcome into today's morning update on COVID-19 inside the Dulcie Simons Jr. Family Broadcast Studio. Kansas Governor Kelley is calling now for mandatory masking as of this coming Friday. We are going to talk about that coming up here in just a few moments. And we are entering another big holiday weekend, which means that gatherings with family and friends, and that can be dangerous, of course, as we know. And then you add a pandemic onto that, not good. You add fireworks to the mix, and this 4th of July could be especially dangerous. The U.S. Product Safety Commission logged 12 deaths nationally last year from fireworks and 10,000 injuries that required emergency room visits. Kids up to age 4 had the most injuries, followed by older teenagers ages 15 to 19. And sadly, we had several visits to our emergency department last year. And and joining us in studio today is Dr. Dhaval Bhavsar. He is the co-medical director of the Health Systems Burn Center. We're so glad you are joining us today. And before we get to those 4th of July numbers from last year and those injuries, we want to hear the inpatient numbers from Dr. Dana Hawkinson. He is our medical director of infection prevention and control. How are you today?
Hi, good. Good to see you, Dhaval. Always good to work with you.
Oh, yeah.
Does great work. So, the last couple weeks we got really concerned because our numbers had gone from 9 or 10 in the hospital up to 24. So we were thinking that was a continuing increasing trend. But luckily now we are down to 17 patients. So if we can keep that 20 or less or 10 or less, that's going to be good, considering all of the infections that now are being diagnosed. We have 17 in the hospital. 7 of those are in the ICU and only 2 on the vents. And I did see one of the patients yesterday. Patient is not on the ventilator, luckily, but he is younger. He is 45 years old. So again, this disease does affect younger people as well. Hopefully that patient can be discharged and do well. But other than that, hopefully we can continue to keep the numbers down.
What are your initial thoughts on the masking mandate from Governor Kelley?
I think it's good. I think, again, we have really good population data suggesting and saying that people or countries or areas that mask have lower spread of the disease and hence lower mortality, lower deaths from the disease. So it's a good culture change. Hopefully it won't be long, but for the time being, I think it's the best thing to do. And if people can just do the masking when they're in those confined areas, when they're can't physically distance. It should be a short amount of time. The masking will not affect your ability to exchange gas, oxygen, and CO2. Your breathing should be good. Obviously, if you have serious or significant medical conditions that don't allow you to wear the mask, but that in general is not going to be most of the population.
And some of the requirements are things that you've been saying we should just be doing anyway. So hopefully people are on board. We'll talk a little bit more about that today. Dr. Bhavsar joining us today talking about fireworks. We were saying earlier about your predictions. People have been cooped up. They are ready to be around family. What better thing to do than get together and light stuff on fire, right? And that could be very dangerous. What are your predictions?
Oh, yeah, I'm worried about it. I think people have been indoors for the last 3.5 months. Yes. Kids have been indoors. This would be the easiest way for parents to make sure that they can enjoy. And this is what worries me. There will be many more families doing lighting fireworks, some of them not experienced. And add to that, parents enjoying their own time, not being able to keep eye on the kids, much higher chance of injuries.
Well, and people are going to be staying away from big crowds as well. So we were predicting that more people will be having those gatherings at home.
Yeah, not having chance to kind of go out and watch those fireworks. I do worry that the kids will be kind of doing fireworks at home. More and more kids than last few years. Okay,
so we brought in some graphs to help illustrate a little bit of those numbers. So if you can kind of help us break down what some of these mean here on the screen.
So this one shows what different type of fireworks cause injury, and as it's predictable, the sparklers and mortars cause the most injuries. I think sparklers being held in hand, and either it's kind of light, like those light and get the hands in the middle of it by mistake, kids touching it causes the hand injury, or sometimes they blast and cause injury to both hands and face. Other one is a mortar, that's where the curiosity kills the cat. People it doesn't light up immediately. People are running into it to see if it would light up. They want to light it again. They kind of wait, and it will blast right when you're trying to get on it. And I think that's the most common male behavior. We see many more male than female, especially with the use of mortars. Those are the really bad hand injuries we see. People will kind of get really like bad burns of the hand, sometimes face also, and then the potential for losing digits, losing fingers.
I want to talk to you a little bit about that, about what to do if that happens. We hope it doesn't. So you're saying men more than women?
Correct.
Is that because the women are telling the men, you're up, you got to do it?
I think men just are
More
kind of prone
adventurous.
to, yes, or prone to taking risk.
Well,
When
you said
Making
some
poor
not,
decisions.
yeah.
bad decision making. Okay, maybe more adventurous. You said that you lived for fireworks when you were younger.
Yes.
You had to
Growing
have them.
up, and it's ironic, like doing burn surgery now, looking back, I'm like, who
What
was
were you
that person?
thinking?
Right.
Yeah, what was I thinking? Who
Right.
was that person? Like, I would beg my parents to buy fireworks after I would have received some from my grandpa, who would buy it for all the grandkids. So I think it's kind of changed, but I see how dangerous it can be. So I've been kind of holding it up from my kids.
So how?
All this-
And now we see how your career takes shape. Like that. Okay. What about you? Do you and your kids get have a little fun on the
yeah,
fireworks?
Absolutely. You know, I like the sparklers and the stuff. You know, no bottle rocket fights, no Roman candle fights. Don't shoot it at anybody. You know,
Yeah.
do it as it's intended to be used.
Okay, we're going to talk a little bit more about that, but
Who would have even thought of that? It sounds like you may have some
Guys do,
experience.
guys.
I was like, you're supposed to hold him? I didn't know we were having bottle rocket fights. I didn't-
You know, poor decision making for men comes from about what, 13 to 35, so
Yeah.
or
Okay.
above.
and it's kind of peer pressure, kind of, yeah.
Okay, good to
Yeah.
know. Good
Some
to know.
things sound fun in your head. And
Yeah.
Okay.
don't have to be fun.
We'll pull it out of you guys today. Okay, so we're going to take some media questions. If anybody's on the line for any questions from the media.
Hi guys, can you hear me?
Hi.
Hi, this is Kara with Fox 4. Hope you guys are doing well. Thanks for continuing to do this. We appreciate you. Wanted to ask real quick, obviously in relation to this mask mandate, you have probably seen some iteration of this. There are a lot of crazy graphics flying around saying, wearing a mask will reduce your oxygen capacity by up to 60%, increase your risk of CO2 poisoning, things like that. Can you talk a little bit about, first of all, the veracity of those claims and the concerns that so many people find it, to be more dangerous to wear a mask than to actually do it and keep themselves and others safe?
Yeah, I think this is just some more information that we need to continue to put out there and be the source of truth. There is no evidence, and again, we are talking about people who can medically wear a mask, who don't have significant COPD or things like lung cancer or other reasons why they can't breathe with a mask on, and that's a cloth mask or a surgical mask. But any of those cloth face masks, surgical masks, or N95 masks, you are going to have very adequate gas exchange. So oxygen is going to get in, and carbon dioxide is going to leave. And that will not be a problem. Also, wearing the mask is not going to decrease your immune system either. In fact, what it has shown, again, is that you can have decreased spread of the infections, thereby leading to decreased mortality. We have Dr. Bhavsar, who's in the OR every day doing complex surgeries for people who have burns and other conditions, who is in there for hours on end with a mask on. And obviously, he has not had a problem, and I don't know if you want to comment on that as well, breathing and all that.
Right. That's exactly what I was thinking. As surgeons, like for decades, we have been wearing masks for hours at a time. And I think as long as you're generally healthy, no COPD, no other kind of respiratory problems, I think wearing mask, even the surgical mask, should not cause you any problems.
Any other questions from the media?
Just a quick little follow-up to that. Another thing people have been experiencing, those, especially those essential workers that wear these for many hours a day, are starting to see some skin irritations and things like that. Is there anything you can do to that area, kind of around your chin, your nose, to sort of help alleviate that?
Well, I would like to say, yeah. So certainly the skin problems are very well documented. We have our own healthcare workers in the emergency department who, especially with the N95 masks, they're a little bit rougher on the bridge of your nose. The other skin irritations as well. Certainly try to contact a dermatologist if you can. There are maybe over-the-counter things that you can try. A lot of it is probably irritation due to dryness and rubbing. But if you can try to do that, that may improve it. And I don't know, Dr. Bhavsar, if you've seen any of those or had any issues with skin irritations from masks in your clinical practice?
Right. Luckily, I have personally not, but I have seen people working in operating room getting those. And what we usually recommend is when you get the time to take the mask off, I think moisturize the skin well, and if it's really irritated and you have to use some topical steroid cream, but ask your doctor, ask a dermatologist before you start anything that is a very significant or potent steroid cream. But definitely moisturizing it, giving some kind of break in between when you can, I think it will definitely help.
Yeah, I think we've been thinking about that. If these guys can do it every day,
And we
all
do
day,
see it. We
can
see
do
it in our ER. We see it up on the floor. So it's well documented. There are things steps you can take to help treat, but also prevent.
Kara, thanks so much for your question. Any other questions? Jill, do you have a good one from the public?
All right, so Leanne has a daughter. She's getting ready to go to Alaska. Alaska requires that 72 hours prior that the daughter have a negative COVID-19 test. So she has a couple of questions. One of them is, do the tests work if you self-administer them? Would it be and what kind of test? Is it going to be a PCR?
Yeah, I don't know. The test is most likely going to be PCR. There's possibly an antigen, but I don't know the full extent of the validation and the or emergency use authorization by the government to allow those antigen tests right now. So it will probably be just a nasal swab, not a nasopharyngeal swab or the brain biopsy that we have talked about. It could even be a saliva test. And again, we still need to continue to finally vet out and validate all of these labs that are producing these. Certainly as we move forward from 10 weeks ago, 12 weeks ago, those labs and those tests now are becoming more validated. So the test should be quite sensitive if it's done in the correct way. All of the PCR tests that we have for different infections tend to be very sensitive, so it can pick up any evidence of the virus that's there. I would have to know exactly what kind and which one of the labs or the viral tests that you're doing. Is it going to one of the local labs? Is it going to be done by our health system? Things of that nature.
And she has a follow-up to it. There was a lot to unpack in her question, but she says that there's some crossing of state lines, like her daughter's visiting but lives in Colorado, won't get back to Colorado in time for the 72 hours, and is finding it difficult to find someone to give the test because they want to test people that are in their state. Do you know how the tests are counted and recorded and that kind of thing?
I think ultimately the result will go to the county of residence. But I know that there are some local places around here, even places of business stores, companies that will do them. I don't know extent. Some of them you don't even really need a physician's order. You can just show up and they'll test you. So I think we have to kind of figure that out. But ultimately, I believe the result will go to the county of residence.
All right. Alex asks, I have a reusable mask. How should I clean it and how often? Mm-hmm. What do you guys do?
Have you had to clean any of yours?
N95, we do have a recycling or cleaning kind of that is done with the UV, but regular surgical masks means knowing the level of risk between the patients, we do discard them and kind of on the daily basis.
Yeah, I would agree. I think here in the health system we have a company that has provided services to clean and reuse our N95 masks. That is Pathogen. It's a local company. And I believe it uses the aerosol hydrogen peroxide. There are some other methods, UV light. There have even been some home methods that have been experimented with and validated somewhat, such as steaming in the microwave or baking in the oven has even been one, having it at a certain temperature for a certain amount of time. Again, the typical surgical mask we wouldn't use. If you were having just a cloth-based mask, we've really recommended that you have 2 or 3 of those so that you can wash them. And while one's being washed, you can have one in storage and one being used. So I think it just depends if you have an N95 versus a cloth-based mask. We probably would not recommend cleaning or reusing the surgical face masks, those light surgical face masks.
Do you both wear cloth out in public sometimes?
I usually have surgical face masks with me all the time, so that I carry one. Yep.
I figured.
I do have a couple of cloth face masks in my car, but typically I'm able to use a surgical face mask. And certainly we see now that a lot of the grocery stores or common pharmacies are selling boxes of those otherwise common surgical face masks. Again, I don't know how well and vetted or validated they are for healthcare worker use and in the hospital, but I think for this purpose and wearing those out in public, to the airport, to the stores, to the restaurants, I think it's going to be very efficacious.
I have a question from Sheila. Can I ask real quick, Jill? Because we're talking about big gatherings possibly over the 4th of July, but she's thinking that the Indy 500 is going to be going on in August. Is it safe to go?
You know, again, I think, you know, we are talking about an outdoor situation, so that's good, just as the demonstrations and protests were an outdoor situation. But you are still going to be packed in with, you know, hopefully you will have masks on. I still think it's a very dangerous proposition. Also, by that time, airports will probably become busier. I don't know if you're driving or flying. That obviously matters. Airplanes, airports, certainly other modes of transportation, buses and trains are very risky as well. I think at this point in time, we know how much the spread is exploding. We know how much it is. Every day we are seeing more and more new cases. At this point, it really seems like a dangerous proposition, especially if you're going to be in the stands around other people in close proximity to those people.
And then you add the travel on top of it,
Right.
so not good. What do you got?
Sue has her father coming home from a skilled nursing rehab facility next week, and he's going to need caregivers in the home pretty much 24/7 at the beginning, and she wants to know, should they wear masks?
Well, I think that really comes down to a healthcare worker issue. So I think absolutely mask wearing is going to be very good for both parties if they can, for the person being cared for and the person who's caring for that person. You know, eye protection as well can be a very good thing, especially if they are a healthcare worker. They hopefully have access to goggles. If not, again, Amazon or the hardware store, anything like that is going to be important. But I think both parties wearing masks is going to be very important moving forward.
Your thoughts on that, Dr. Bhavsar?
Yes, again, the same, like as we do kind of practice that social distance and then the personal protection, same would be at home, like this person coming back from nursing home has the same risk and a potential risk to the healthcare worker. So I would say it in both ways. We should maintain that same practice.
All right, can I put my mom hat back on and talk about fireworks while I've got you here? So what kind of injuries do you see the most of?
I think most common would be kind of burn to the hand and face from a sparkler. Most commonly would be in a child, usually like 4 years or younger. They are kind of all the way in. They don't know control. Either a child who is turning to the side and getting someone else burned, or the one who is holding and suddenly kind of does kind of movement to the face, and then all the sparks are in the face.
How do I know to bring them into you? So there's a burn. I think I throw an aloe plant on it. I have my aloe plant by my kitchen sink, but how do I know it's bigger than that?
Right. And I was just thinking how to explain. Like, so the parent, like, means if you can put 1 or 2 Band-Aids on a wound and that's easy to cover up with that, and that's how small the burn is, I think it's something that you can kind of treat at home. If you're concerned, you can call your primary care kind of doctor's office. If it's much larger than that, it involves entire digit, entire hand, I think it'll be good for you to call us, come over to our ER, and then we will be able to see you right away. We do have staffing available over the weekend to make sure that we can see these patients right away, and we have additional clinic appointments over the next week available so that we can take care of this.
Any unusual injuries you've seen? I'm sure you have, but...
Yes, and again, in a child, after July 4th, like parents had packed away the fireworks, but they were the dangerous kind, like M80 kind of, ones. And a curious child knew exactly where they were. The parents thought they were safe. Child alone at home got kind of hand on it and thought that I can do what my dad did, and lost most of the hand.
Oh,
that is
you just telling me that story was just like taking my breath away.
And I mean, like unusual. I would rather kind of put it that it's a risky business, and I really think that we need to always take it seriously. And as a parent, I really, really worry.
All right, Jill, do you have a question?
I do, and it kind of dovetails into what you just said. Margene says, how do you talk to especially younger people who are engaging in risky behavior by not wearing a mask, and who don't want to social distance, and who do not believe that masks help, or that that really it's a problem. They're not going to make anybody sick. How do you deal with that kind of thinking? That's her ask. She needs some words and language to help her.
Well, again, this is a huge culture change. We've seen this in Asia and Asian countries, China, Japan, South Korea, other places like that. They have been wearing masks for quite a long time. A lot of reasons they do it also, though, is for pollution. And we know that it does help with allergies. So this is just going to be a huge culture change moving forward because of what we're facing right now every day, the pandemic of COVID-19. Hopefully it won't have to be that long and we can go back to what we were doing and not wearing the mask. But it's just going to be continually reinforcing, this is out there every day. There are valid media outlets to get your information from. There is the CDC website. There is the Kansas Department of Health and Environment website. There is the Missouri Department of Health website. There are places that you can go that you can get the correct information. It's just going to be continually reinforcing that message. There is actually good data to suggest that wearing the mask does help and does improve this. And we can do that by not only wearing masks, but the physical distancing and the adequate hand hygiene. So it's just a matter of, if you're learning anything new and something that we haven't had to do for 30, 40 years, however old you are, you've never had to do this in your life. It's just going to be continually reinforcing that message and talking with them, getting answers to their questions in their correct manner, and trying to continue to reinforce that.
Yeah, it's not part of our culture, so
Right.
we're not used to it. Hopefully the mandate will help open those conversations. And Brooke had a similar question about ballpark. She said she's infuriated. Just how do you tell somebody in a non-rude way? She wants to know, and both of you, maybe you have some advice on how do you nicely open up that conversation.
You can't just say because I said so.
No, Jill, you cannot. Apparently that doesn't work. And now we're seeing people, lash out at people at grocery stores, and it's on social media. But there's got to be a way to, I guess you said, educate people on the right way to do it. Do you have any words or thoughts on that?
I mean, maybe not precisely, but like as surgeons, like we do, and in operating room, we take the utmost precaution. Like everything is sterilized. Everybody wears the kind of and then follows the sterile guidelines. Means we would scrub, we would wear sterile kind of gown, gloves, and then wear surgical mask during the surgery. Why? Because over years we learned that doing that reduces the infection chance. And nobody now argues against it. Right. You wouldn't want your surgeon to do surgery with bare hands, right? Because you know that it would be a higher chance of infection. I think the wearing mask is very much the same in this situation.
Yeah.
Masks work.
Yeah, and I agree. Whether it's at the ballpark, if you're watching kids' Little League games, other outdoor events, I think there are easier methods to physically distance from other people. And you can still have conversations with them at 6 to 8 to 10 feet apart. The mask's not so much needed in those situations. Obviously, if you can't physical distance in those situations, that's when you're needing the mask. But being outdoors and being able to separate from other people is really what's going to be important. And hopefully, as other people are doing it, and now there are the mandates, it will become more just like second nature.
Jill, next question.
Yeah, Gene's got an actually good question. He's asking, what is the primary danger beyond the fireworks about being together? Is it the dishing out of the food? Is it the space that I'm maintaining?
Yeah, absolutely. So obviously communal things are important. So if you have a potluck or a table set up with foodstuffs and you have utensils scooping that into your plate, you're going to have contact with those types of things, those types of utensils that other people are using. So that's very dangerous. That can spread the disease. And then if it's on your hands, fingers, you're rubbing your eyes, your nose, your mouth. Now the CDC does say that that's probably not the most likely method. We do know that the virus is spread through droplets. So droplets that you breathe out when you are, again, breathing, laughing, coughing, sneezing, anything like that, the droplets. Now most of those droplets, a majority of those droplets will fall at probably 6 feet or maybe just a little bit more or just a little bit less. And that's why the mask is so important. That's why the proximity or the distance from other people is so important. So if you can maintain that 6, 8, 10 feet, you are going to reduce your risk of coming into contact or inhaling those droplets or particles more than if you were closer than that. And so that's really why we are talking about the physical distancing. but also the mask to provide a barrier so that if you do have the infection and you do not know it, or maybe you have symptoms that really you don't think are COVID symptoms and you are shedding virus, that's going to reduce your risk of shedding more virus if you have the mask on. And if you're further away from a person, that's going to be reducing your risk of coming into contact with those droplets.
Do we have time for a couple more?
Yes, we do. Sean wants to know, do you think the increase in cases the past couple of weeks is from Memorial Day activities? And what do you think the risk is from the 4th of July? What are we looking at?
Yeah, that's pretty good. So certainly Dr. Fauci, I believe last week, thought that and we can't even really call this a surge anymore, we just have to call it a continued expansion, I think. Certainly we thought that some of those things were due to Memorial Day. So we aren't looking at 2 weeks from Memorial Day. We've been looking more at like 4, 5, 6 weeks from Memorial Day. And certainly as we go into 4th of July, where people are going to want to be together, be with friends, be with family, be with loved ones, have a good time, we could certainly see further expansion of that. And the danger of that is, number one, you are continuing to have more and more infections. The other danger is now we are getting closer to school session, when you're going to have little kids going back to school. You're going to have older kids going to college. So, they will bring it to their colleges and their schools and things of that nature. And the disease is likely going to continue to spread, as we have seen. Hopefully we won't get a lot of the super spreading events at parties or get-togethers, but that is a very real possibility, and that is always out there.
All right, so I know that Dr. Bhavsar has to get to the OR, so we'll do maybe 1 and 2 quick real questions.
Okay.
This first one is from Joyce, and by the way, the questions are getting so good, and it is very hard. And on Thursday, again, we're keeping track. We'll make sure that we roll right through them. Joyce and her husband are both at risk, high-risk people. They need to get some flooring in their house. It's going to take 3 days, 3 workers. They want to know what the risks are. The workers will take their temperatures, but they say they're not wearing masks. What would your advice be?
I would try to avoid those situations where you're coming into contact. Again, we're talking about time of exposure and proximity. So if you are just speaking with them, you can certainly speak to them outdoors at 6, 8, 10 feet. You don't hopefully have to be in the house or in that proximity to them or in that room where you're getting flooring during that time. All of that will help reduce the chance of infection. Also, if you feel the need to wear the mask while indoors, if you cannot be separated from the room, that is something as well. Again, we have said that masks, especially the cloth face masks, don't really provide protection from infection, and we would not use that in the healthcare setting. But they do provide some amount of protection compared to a surgical mask, 40 to 80% in different studies. But that is not the main goal. The main goal is to use as a barrier to protect other people if you have it. So certainly if you want to wear the mask in the household, that may help reduce the risk of getting the infection if any of those workers have it. Otherwise, try to be out of the room or out of the area where they're working, and doing all of those things should absolutely reduce your risk.
Last question.
Yeah,
Both Loretta and Brandon, 2 separate people, but they have the same question, and that is, where are the cases coming from in the community right now? Is it the grocery store? Is it where I'm getting my hair done? Is it church? Where are they coming from?
That's a good question. So across the nation, and even here at the health system, we've seen that we have evaluated or admitted younger patients as well as the older patients. So the demographic, I think we're fairly certain that is getting the disease and is probably the younger, 20 to mid-30s, and that's what we've seen around the nation. Where is it coming from? I think it is hopefully less likely things like the grocery store, if most people can be wearing masks, and you're having very limited interaction at the grocery stores. Most of them do have the markers on the floor, so even if you're waiting in line, you're going to be separated. Hopefully you're not touching or manipulating your mask while in those places. We really suspect that it's either large gatherings that really aren't known about. We've had a very good documentation of things such as churches and workplaces that have been clusters of infection. But now, especially in states like Florida and things of that nature, we've seen obviously bars and restaurants and in the evening and when young people are going there. So don't have any specific demographics, just general demographics and trends around the nation, and those seem to be where they are coming from. Now, as churches open up more, some are more lenient than others on different rules such as physical distancing and mask and hand sanitization, things of that nature. That could be another place as well. And I know that Kansas and Dr. Norman is working on looking at and investigating many, many clusters of infections around Kansas. So hopefully as we move forward, we'll find exactly where, but those tend to be the biggest places, the largest places where we are seeing spread.
Great answers today.
Yeah.
Great questions. So thank you both
I
for
hope the
that.
answers are-
Want to get to our final thoughts from both of our doctors. Dr. Bhavsar, thank you so much for coming in. I know we talked about. I always say it's so great to see you in the hallways, but I don't want to see you this weekend. You know, we want to
No.
stay safe out there. So
I feel the same
and I
way.
always I compare fireworks to like swimming pools. It's like everyone's watching, but no one's watching, and you have a false sense of security when you have friends and family around. So it can be really scary. And some of those stories you shared definitely drive that home. What do you really want people to know as they head into the weekend?
Be safe. Definitely try to be safe. Watch out the kids. Yep. Don't drink and drive. Then don't drink and use fireworks.
Yeah, that makes sense. And I did a little mom blogging last night, trying to find some safe ways to have fireworks and fun, but with no explosions and no lighting up and doing anything crazy. But anyway, so I've got a couple of ideas, like confetti poppers. These are things I'd never even thought of because normally they would make a mess and I wouldn't want to have to clean this up, but I would do that this weekend. Glow-in-the-dark bubbles, glow sticks, silly string, glow paint, rocket straws, lots of fun stuff that kids can do. And stay safe, most importantly. Dr. Hawkinson, what are your final thoughts today?
Again, I think it's a good idea, and I really support all of our leaders who now have had the mandates for the masking. It's consideration for others. We know that's important. Also, it can also offer a modicum of protection for you. Again, the masking, hopefully it's not going to be that long. If it's an errand to go into the store, you're not going to be in a mask very long. Remember to do good hand hygiene prior to putting the mask on and after, right before you are taking it off. Hand hygiene is important. And we've said, I think this before on this broadcast or another, that treat your mask like underwear. So you're not going to be manipulating it many times a day. You want to make sure that everything is covered, so have it above the bridge of your nose, because if it's down below your nose or below your chin, you're still allowing viral particles or droplets to get in, at least to your nose and your mouth. So wear it properly. Do the hand hygiene. Do not manipulate it. We do understand that there are certain populations that can't wear a mask. Certainly children, especially under the age of 2, are going to find it very hard to have a mask on. And even children a little bit older that are going to have difficult time not manipulating it. But please talk with them and try to get that. And then there's also the people who are deaf or can't hear, may find it a little bit more difficult to wear the mask. And of course, people with medical conditions such as severe COPD or other conditions in which they can't wear a mask. But for the most part of the population, for the general population, they will be able to wear a mask. And if you're doing that properly, you can offer protection to yourself, and certainly you're going to offer protection to your fellow citizens.
Wear your mask like your underwear. I don't know if it could get any more clear than that. That might be the best thing you've ever said.
No, not wear it like, treat it like
treat
that.
it like that.
Don't wear a mask down there.
Thank you. Thank you for clarifying.
Yeah,
Okay.
treat it like that.
Treat it, not wear it. All right. Well, we've been talking about this morning. KDHE Secretary Dr. Lee Norman is going to join us tomorrow to talk us through that mandatory mask wearing. We'll also check in with the president of the Overland Park Chamber of Commerce and Johnson County Public Health Officer, Dr. Joseph LeMaster. They are holding the annual 4th of July fireworks over in Corporate Woods. It will look a little different this year. We're going to talk about how to keep your family safe, and if you do decide to attend, if that's going to qualify as a mask-wearing event. So they are required to wear masks right now in Wyandotte County, Douglas County, and Kansas City, and later this week, the state of Kansas. And with good reason, because we know that we've talked about it. We talk about it every day. The science works behind mask wearing. So I wanted to show you how our family is doing it. This is my 7-year-old daughter, Sunny. She does wear her mask out. She kind of likes it. She likes her fashion mask. We go out, we wear it shopping. So she's trying to set example for the littles out there that it's a good thing to do. So my son Dominic, he's 4. He doesn't we keep him home more often. They don't brush their hair, apparently, but they do wear their masks. So that's that. We've also got Marisol. She's wearing her Chiefs, showing her Chiefs spirit there with her mask. We love that. And then Cherie and her husband using their masks, as we can see here, to keep those K-State fans away. So way to go, guys. We appreciate that. And sometimes we can kind of feel like Lone Rangers out there. We get kind of strange looks, but maybe you're the only one who walks into a place without a mask or with a mask on. So hopefully we're trying to show people that wearing a mask is cool. Being safe is cool. Keeping other people safe is cool. So even when it's not mandated to do so. So hopefully people have gotten into the habit and will continue to do that. So send us your photos of you staying safe, wearing your mask, social distancing, getting together with friends. Send those to Facebook or email us at medicalnewsnetwork@kumc.edu. And as we mentioned yesterday, and we will this week, we want to hear your stories. We know that many of you have been impacted in different ways, and there are people who remind us every day that this disease is serious, it's deadly, and it's the real deal. And we really want to put a name and a face with the numbers that we talk about every day. So please reach out to us on Facebook or again at the Medical News Network at kumc.edu. And we thank you so much for joining us today, being with us. Have a great day, and we'll see you back here tomorrow.